Cancer is on the rise, and more people are being affected by it than ever before. So, the real question is, would you recognize the warning signs if your body was trying to tell you something? Welcome to HealthHorizon, where we bring you science-backed health insights that help you stay ahead of serious health risks. Each year, millions of people are diagnosed with cancer, and the numbers continue to climb. Some types, like pancreatic or brain cancer, are especially silent, often showing no symptoms until it's too late. But here's the truth. Early detection is the key. It could literally be the difference between life and death. Recognizing the warning signs of cancer early on can drastically increase your chances of successful treatment. Now, I know what you're thinking. Does every little symptom mean cancer? When you search online, it's easy to be overwhelmed by all the possible diagnoses. That's exactly why this video is different. We're not here to scare you with vague information. We're cutting through the fear and the misinformation to bring you real, scientifically proven warning signs that have helped thousands of people catch cancer early when it's most treatable. Your health is far too important to ignore. So, subscribe to HealthHorizon, pay attention to your body, and let's go over the 15 crucial signs that could save your life. Sign number 15. Persistent fever. Let's talk about fever. A persistent fever, especially one that keeps coming back with no obvious cause, could be your body's way of signaling something serious, like blood cancer. Unlike regular fevers that typically subside within a few days, cancer-related fevers tend to follow a distinct pattern. Conditions like leukemia and lymphoma can trigger the immune system to release chemicals known as cytokines, which may lead to recurring fevers. These fevers often appear without any clear infection, and they could come with other symptoms like night sweats or unexplained weight loss. In some cases, the fever follows a pattern known as cyclic fever, with temperature spikes at regular intervals. When a fever lasts more than 2 weeks or keeps returning without a known cause, it's time to get it checked out. Blood cancers can compromise your immune system, making you more vulnerable to infections, while also directly causing fever. A thorough evaluation typically includes blood tests to check for abnormal cell counts and other indicators of disease. Sign number 14. Jaundice. Next up, jaundice. Have you noticed a yellowing of your skin or the whites of your eyes? Jaundice happens when there's a buildup of bilirubin in the body. While jaundice can be caused by a variety of conditions, its sudden appearance in adults is often a red flag for pancreatic or liver cancer. In pancreatic cancer, tumors can block the bile duct, which prevents bilirubin from being processed and expelled from the body properly. This causes bile to spill into your bloodstream, giving your skin and eyes that yellowish tint. At first, the yellowing may be subtle, but it can quickly become more noticeable as the condition progresses. Because the pancreas is deep within the abdomen, early detection of pancreatic cancer can be challenging. That's why recognizing jaundice, especially when it's accompanied by upper abdominal pain, dark urine, or light-colored stools, is so crucial. Sign number 13. New or unexplained pain. And then there's pain. Is there a pain that's been bothering you without any obvious cause? Pain is often your body's way of signaling that something is wrong. If you've experienced pain that doesn't have a clear reason, like an injury or illness, and it doesn't respond to typical treatments, it could be a sign of something more serious, including cancer. For instance, abdominal pain could indicate prostate, bladder, testicular, or penile cancer in men. In women, breast pain that's unusual and doesn't go away with typical remedies could point to breast cancer. The key here is that this type of pain isn't typical. It doesn't go away with the usual fixes. It lingers, sending a strong message that something more serious could be at play. Pain can also indicate internal cancers, so don't ignore it. Sign number 10. Eye pain. Our eyes are often the first place where we notice signs of something wrong in our body. They can reveal crucial information about your overall health, including potential cancer signs. Ocular melanoma, while rare, is the most common type of eye cancer in adults. The symptoms of this cancer usually start off subtly, but can progress to more noticeable changes. These changes shouldn't be ignored. When cancer develops in the eye, it can lead to symptoms that are different from the usual eye problems you might encounter. For example, you could experience blurred vision that doesn't improve even with new glasses. Or, you may see strange flashes of light that aren't linked to a migraine. But the most concerning sign of all is a dark spot that appears on the iris, gradually changing in size or color. If you have fair skin or colored eyes, you're at a higher risk for ocular melanoma. So, don't ignore persistent eye pain or vision changes. Early intervention could save your vision and potentially your life. Regular eye exams are especially important if you have risk factors, so make sure you're staying on top of them. Sign number 11. Bone pain. Bone pain can often be overlooked or dismissed as a minor issue, but when it persists, it may be a signal of something more serious, like cancer. Unlike the temporary discomfort from exercise or minor injuries, cancer-related bone pain often intensifies over time, particularly at night. It can start subtly, sometimes feeling like a sprain or muscle ache, but it can quickly become more severe and constant. When cancer begins in or spreads to the bones, it disrupts the normal bone tissue structure, causing a deep, penetrating ache that is hard to ignore. For example, osteosarcoma, a form of primary bone cancer, often affects the long bones in the arms and legs. What makes this particularly concerning is how bone pain can start interfering with your daily activities, making even simple movements difficult. Patients with bone cancer often describe the pain as a throbbing or aching sensation that doesn't respond to typical pain relievers. If you're noticing bone pain accompanied by swelling, increased tenderness, or unexplained fractures, it's crucial to see a doctor right away. Early detection of bone cancer dramatically improves treatment outcomes, and survival rates are much higher when the cancer is caught in its early stages. Sign number 12. Fingernail marks. Subungual melanoma. This one is often overlooked, but it's crucial. Changes in your nails can reveal early signs of subungual melanoma, a form of skin cancer that develops under the nails. It often starts as an innocuous-looking streak, which might be easy to dismiss. This dark line is called melanochia striata, and it runs vertically along the nail. However, it's important to note that these cancerous streaks are not like normal nail pigmentation. They typically appear suddenly and continue to evolve. The most common locations for subungual melanoma are the thumb or big toe, but it can occur on any nail. What makes this particularly dangerous is how easily it can be mistaken for normal nail trauma or a fungal infection. There are several key warning signs you should look for, including a dark streak that's wider than 3 millimeters, streaks that have varying colors, or streaks with blurred borders. Understanding Hutchinson's sign is also crucial. It refers to when the dark pigmentation extends beyond the nail and onto the surrounding skin. If you notice any changes in your nails, especially if they're accompanied by pain, splitting of the nail, or bleeding, don't wait to seek medical attention. These could be critical signs that your body is trying to tell you something serious. Catching these symptoms early can make a significant difference in cancer detection and treatment. Sign number 6. Mouth sores that won't heal. Have you noticed any sores in your mouth that just won't seem to heal? While most mouth sores, like canker sores, heal on their own, sores that persist for more than 2 weeks could be a warning sign. Persistent mouth sores can be associated with oral cancer, which affects the lips, tongue, cheeks, gums, and the roof or floor of the mouth. If left untreated, it can spread to other areas. What makes this especially concerning is that oral cancer can sometimes develop without noticeable pain, so many people might overlook it. Sores that don't heal, or that change in appearance or size, should raise red flags. If you're also experiencing difficulty swallowing, pain while chewing, or lumps in the mouth, these could all be signs that need to be checked by a healthcare provider. Early detection of oral cancer is key to successful treatment, and regular dental checkups are essential for catching signs before they become serious. If you're noticing sores that last longer than usual, don't wait to seek medical attention. Your health deserves attention, and it could save your life. Sign number 7. Blood in the urine or stool. Now, let's talk about something that's often unsettling: Seeing blood in your urine or stool. This is a symptom that should never be ignored. Blood in your stool might appear black, tarry, or bright red, while blood in your urine can look pink, red, or dark brown. These are alarming signs that can indicate serious health conditions, including cancer. For example, blood in the stool could be a sign of digestive system cancers, such as colon or rectal cancer. It could also be linked to conditions like inflammatory bowel disease or ulcerative colitis, both of which disrupt the normal function of the digestive tract, leading to bleeding. Similarly, blood in the urine might indicate prostate or bladder cancer, but could also be a sign of urinary tract infections or other issues. Regardless of the cause, seeing blood where it shouldn't be is a signal that something is wrong in your body, and it requires immediate medical attention. If you notice this symptom, don't wait, seek out a healthcare provider promptly to get to the root of the issue and start the right treatment. Sign number 8. A cough or hoarseness that won't go away. Have you been battling a persistent cough that just won't go away? A chronic cough or hoarseness lasting more than 2 weeks should not be dismissed. While many people associate coughing with a simple cold or seasonal allergies, a persistent cough that doesn't improve could be a sign of something more serious, such as lung cancer. In addition to a cough that lingers, coughing up blood or bloody discharge is particularly concerning and requires immediate attention. But that's not all. Hoarseness or a raspy voice that doesn't clear up is also a red flag. This could point to cancers of the thyroid or throat, especially if it's accompanied by difficulty swallowing or pain in the neck or throat area. These symptoms may be dismissed as minor issues, but if they persist, they should be evaluated by a healthcare provider. Don't ignore persistent respiratory symptoms. Listen to your body. If the cough or hoarseness lasts for more than 2 weeks, it's time to consult a doctor to understand the cause and get the right treatment. Sign number 9. Excessive bruising. Have you noticed bruises appearing out of nowhere, or in places where you don't usually get them? Excessive bruising, particularly without an obvious cause, can be a sign of blood cancers like leukemia. This is because leukemia affects your body's ability to produce healthy blood cells, leading to symptoms like easy bruising. If you see bruises on your arms, legs, or other unexpected areas, don't ignore them. This could be your body's way of signaling something more serious. In addition to bruising, you might also notice symptoms like frequent nosebleeds or bleeding gums, which are common signs of blood disorders or cancers. It's easy to brush off bruising as a minor issue, but if it's frequent and unexplained, it needs to be investigated. Early detection is crucial, and if you're noticing frequent bruising, it's best to consult a healthcare provider. The sooner you catch potential issues, the better your chances for treatment. Sign number 4. Changes in urinary or bowel habits. Have you noticed any changes in your bathroom habits lately? Changes in urinary or bowel habits might seem minor at first, but they could be a sign that something more serious is going on in your body. For example, constipation or diarrhea that lasts for several weeks should not be ignored. These symptoms can be associated with a range of health issues, including cancer. Changes in bowel habits can sometimes point to conditions like inflammatory bowel disease, such as Crohn's disease, or even colon or stomach cancer. These types of cancers can disrupt your digestive system, leading to noticeable shifts in how often and how comfortably you can go to the bathroom. Similarly, changes in your urination like pain when urinating, increased frequency, or a weak stream could indicate urinary tract issues. For men, these symptoms might be linked to an enlarged prostate, a urinary tract infection, or, more seriously, prostate or bladder cancer. Even if these symptoms seem like they could be caused by a less serious condition, it's important to get them checked out. It's always better to investigate and rule out serious issues, rather than ignore them and risk allowing a treatable condition to progress. Being proactive about your health means paying close attention to your body and seeking professional help when something doesn't feel right. Sign number 5. Persistent heartburn. Have you been dealing with chronic heartburn or acid reflux? This condition, known medically as gastroesophageal reflux disease GERD, is something many people brush off as a minor inconvenience. However, when heartburn persists despite lifestyle changes and medication, it could signal something more serious, like esophageal cancer. The relationship between chronic heartburn and cancer lies in the repeated damage stomach acid causes to the lining of your esophagus over time. This ongoing irritation can lead to Barrett's esophagus, a precancerous condition that significantly increases your risk of developing esophageal adenocarcinoma. If you're experiencing difficulty swallowing food, a sensation of food getting stuck, or unexplained weight loss alongside your persistent heartburn, it's time to consult a healthcare provider. If you've been using over-the-counter heartburn medications for more than 3 weeks without improvement, don't wait. Early intervention is crucial, and getting the right treatment can help prevent a minor issue from turning into something more serious. Sign number 6. Mouth sores that won't heal. Have you had mouth sores that just won't heal? These sores might seem like a normal irritation, but if they persist for more than a couple of weeks, they should be taken seriously. Persistent mouth sores, especially if they are accompanied by white patches on the lips, tongue, gums, or elsewhere in the mouth, could be a sign of oral cancer. Oral cancer can develop in any part of the mouth, including the lips, tongue, and throat. If you use tobacco or drink heavily, you may be at a higher risk for this type of cancer. The sores or patches might seem harmless at first, but they need to be evaluated by a healthcare provider. White patches in the mouth, known as leukoplakia, can be a precancerous condition that can develop into cancer if left untreated. Don't ignore mouth sores that won't heal, especially if they come with other symptoms like difficulty swallowing or unexplained weight loss. Oral cancer can be aggressive, but early detection is key to successful treatment. If you have sores that won't heal, seek medical advice as soon as possible. Sign number 1. Persistent fatigue. Have you been feeling unusually tired lately? Persistent fatigue is one of the earliest and most subtle signs that cancer could be growing in your body. Unlike the normal exhaustion from a busy day, this is deep, unrelenting tiredness that doesn't go away, no matter how much rest you get. It can be especially indicative of cancers like leukemia or lymphoma, which affect your blood and bone marrow, disrupting your body's ability to produce healthy blood cells. As a result, you may feel worn out even after a full night's sleep. In addition to fatigue, you could also experience muscle weakness or confusion. These symptoms are often linked to cancers that impact hormone levels or cause internal bleeding, such as colon or stomach cancer. It's important to note that persistent fatigue is often mistaken for stress or overwork. However, if you find yourself feeling unusually tired for an extended period, it's time to see a doctor. Persistent fatigue is your body's way of signaling that something isn't right. Early detection can make a significant difference, so don't ignore it. Listening to your body and recognizing when something feels off is key. If fatigue is accompanied by other concerning symptoms, don't delay seeking medical attention. Sign number 2. Persistent headache. Have you had a headache that just won't seem to go away? A headache that lingers despite over-the-counter or prescribed medication could be a red flag. If you're experiencing a headache that lasts more than 2 weeks, it's time to take it seriously. Persistent headaches can sometimes signal brain tumors or other brain cancers. In addition to the headache itself, you may notice other neurological symptoms, such as blurred vision, double vision, changes in hearing, or even facial drooping. These are critical signs that shouldn't be ignored. Other signs, like seizures or unusual neurological events, should also be evaluated by a healthcare provider. These symptoms could indicate that something is affecting your brain's function, and it's crucial to get them checked out. While not all headaches are cancer-related, those that don't respond to typical treatments and last for an extended period require thorough evaluation. Early intervention is critical for brain tumors and other serious conditions. If your headache is persistent and you're experiencing additional neurological symptoms, don't wait. It's better to be cautious and get the help you need. Sign number 3. Body rashlets talk about skin changes, specifically rashes. While most rashes are harmless, certain types deserve immediate attention, especially when linked to leukemia. Leukemia, a cancer affecting blood-forming tissues, can cause distinctive skin symptoms that are often mistakenly attributed to minor issues. One of the most common signs is petechiae, tiny, round spots that appear on the skin. These spots, typically measuring 1 to 2 millimeters, don't fade when pressed. They can range in color from red to purple or brown, and often appear in areas where pressure is applied, like the ankles or areas near tight clothing. This happens because leukemia disrupts your body's ability to produce healthy platelets, which are responsible for preventing bleeding. Without enough platelets, tiny blood vessels can leak, causing these characteristic spots. Unlike common rashes that might itch or fade within a few days, leukemic rashes persist. They may also be accompanied by other symptoms like unexplained bruising or bleeding. If you notice these spots or other concerning skin changes, don't ignore them. Seek medical advice promptly. Recognizing these early signs is key to successful treatment.